The following is a special presentation of Tony Kurre Radio. From hot dogs to cool kitties, this is Darkside of the Pooch.
Woo, 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 woo. Dr. Rab, what you got? Oh, I like that. It's Dr. Rab Stewart. It is another Dark Side of the Pooch. I got to ask you something. We do this show every single Monday. Every Monday is the Dark Side of the Pooch Day. It runs at noon and 8 exclusively here on Tony Kurre Radio. And we're getting lots of downloads on our Spotify platform. Search Tony Kurre Radio, that's Kurre with a K, or Dark Side of the Pooch. It's the only podcast out there called Dark Side of the Pooch. I can promise you that. People are loving it. You go back and listen to all the shows we've done over the last couple of years here with Dr. Rab and the Rossbridge Animal Hospital. How did you come up with Dark Side of the Pooch? It is one of our most original and exciting names for any show we do here on Tony Kurre Radio.
I don't really remember. I just know that when we were talking about doing this, I remember where I was when I came up with it. I was putting my son to bed, who he's 8 now. So, I mean, he might have been only 5 at the time, maybe 5 or 6. And so I was putting him to bed. I was laying in the bed, and you had said, hey, try to come up with a name. And so I was just trying to think of ways I could mash up classic rock and pets. And I don't know, I like Pink Floyd. And so I just kind of started with that. And I thought, well, kind of a little bit of alliteration or whatever poetic term that this is that I can't really, because it doesn't really rhyme.
No.
But I think it might be an alliteration, something. Somebody out there listening knows more than I do. It sounded okay.
I love it. And here's a little piece of trivia for you. You're going to love this. On this date back in 2018, just 4 short years ago, Journey's Greatest Hits was the only third album ever to amass 500 weeks on Billboard's top 200 album charts. Can you name the other 2 albums that have over 500 weeks on Billboard's top 200 all time?
Can I ask for a hint?
Yes. One is Jamaican Man.
No, Jamaican Man. Oh, okay. Bob Marley?
Bob Marley's Greatest Hits is the other one, and you should know. Okay, so go ahead.
I was going to ask if they were Greatest Hits records. Is the other one a Greatest Hits record?
No, it is not, but it has a lot to do with your show.
Oh, Dark Side of the Moon.
Yes, Dark Side of the Moon, which has amassed well over 1,000 weeks. I remember being in high school and going on, and that album had been out for years, and I'm like, it's still like number 65 or number 67. It just ebbed and flowed, but that thing's been on the Billboard Top 100 charts for like 1,000 weeks or something. It's the longest running album in the history of music, Dark Side of the Moon, and that's another reason why we should call it Dark Side of the Pooch. I love it. He is Dr. Rab Stewart from the Rossbridge Animal Hospital, at Rossbridge on Twitter, the Rossbridge Animal Hospital on Facebook, 205-208-0301. We got some Mutt Mail I want to get into, but I want to get into our warm weather. We have a time change going on that I guess I'd be this weekend on March 13th. We got a weather change. It's been in the 80s, been beautiful, and I know our pooches and our kitty cats want to get out and start running again. We got no mask mandate, so people are starting to get outside the house again. It's all coming together at one time. How does that affect our animals? How does that affect our pets when we have, first of all, a time change coming up, and second of all, just warmer weather when our dogs and cats want to get outside more?
Well, it means you gotta look out for certain things. This is starting to get into the snake bite time of year.
Yes.
So watch out for snakes, and if it's hard to know if a dog is bitten by a snake. Because most of the time the bite mark is almost imperceptible. It's almost like a vaccine in a way. I mean, that's how small snake teeth are. And a lot of times, you don't know they've been vaccinated. You don't know they've been bitten by a snake. So things that you can see locally where the bite was, you can see swelling, you can see bruising. The skin will appear really wet because it's edema or fluid. And eventually when you get edema or fluid and it kind of forms a swelling, that will start to seep out from the skin. But very rarely will you see the fang marks. You might not even see any blood at all. But swelling, bruising, kind of seeping of the wound, those are all things that you can see. Fleas and ticks are always a problem where we are. It's not really a seasonal deal, but you will see more of it this time of year. So you got to watch out for that stuff. Be sure that your pets are on prevention for fleas and ticks, and also heartworms. Heartworms are spread by mosquitoes. We're going to start seeing mosquitoes soon. Not quite time for hyperthermia. That comes a little bit later. It's not really hot enough for our pets to get overheated, but that's coming soon too.
So that's really interesting. And again, you've given me about 1,000 more questions. I have had firsthand knowledge of snake bites, and I want to continue to get into that here in just a second. But when you're talking about, humans, we're getting back out too. We start doing things. We start losing weight. We're out exercising more. We want to get that beach body. We want to do all these different things. For an animal, how does it change? Because I would think that a lot of dogs and cats obviously have stayed in. They've been somewhat hibernating, if you will, over the last 3 or 4 months, and all of a sudden we're wanting to take them on long walks. Do we need to make that a gradual process, much like a human being? We don't want to be running a 5K right out of the box in March, but do our animals need to stretch a little bit? Do our animals need to be gradually brought into maybe walking the neighborhood 3 days a week?
Yeah, but not as much as we do. Because they're built differently. Their lung capacity is different, and their muscles are different, and they're also really good at limiting themselves. We're not good at limiting ourselves. We're actually terrible at limiting ourselves, both like physically and mentally and emotionally. At least I am. I always want to go. I never want to stop. So it is good to let them kind of ease back into it, but they're going to pretty much police themselves. So if you're taking your dog out for a run, taking them out for a walk, when they stop, you need to stop. If you're taking them on a run with you, give them a break, because they'll go until they'll go until they're ready to be done. Just don't push them.
Yeah,
if you want to ease, if you want to ease them into it, that's fine. If you want to ease them into it, that's fine.
Yeah, I had never run a race in my life until about 13, 14 years ago, and there was a 10K race coming up that was in Mountain Brook, and I was doing it for my son, and everyone was like, you're going to kill yourself. How are you training this? And I didn't train at all because I knew that if I went through a training process, I was going to get banged up before I could actually run the race. So I thought, I'm just going to take it nice and slow, and I'm just going to get through the race, and I made it, and I was probably last in my age group, but at least I got through it. Don't do it that way. The best way is to do some stretching, get ready. First Mutt Mail here, and I want to get back in these snake bites because I think it's really interesting. Tracy Nauvoo, and this is perfect. She wants to know, can dogs pull muscles? And if they do, how do you know?
Yeah, they can have musculoskeletal problems with pulled muscles and torn ligaments and meniscus and strained tendons and all that stuff. And a lot of times we don't know. We suspect based on the exam, if we manipulate their joints, we put pressure on their bones, put pressure on certain areas, they may or may not tell us where it's painful. So if you have a dog that's limping, we go through a whole process of trying to figure out where they're sore. And sometimes you can't. Sometimes they're limping. And when you get to whatever spot that's sore, they don't try to spin around and bite you or yell or growl or anything. I mean, they're just, can be kind of stoic that way. But if you get to a certain part of the body and they're painful, and then we'll usually take x-rays. And if the bone is not, there's no problem there, then we kind of assume it's a soft tissue injury, which is muscle, ligament, tendon. And then we just, have you rest. Maybe give them an NSAID, have them rest, and not do a lot of running and jumping and things like that. But for, more advanced stuff, I mean, dogs can have MRIs and CT scans.
Really?
And that can give you, a little bit better idea of what's going on. But, most of the time we don't make it that far unless they need it for, a life-threatening issue. Because usually some rest and some medication for inflammation, that'll take care of most, muscle problems.
There you go. I want to get back to the snake thing. We're talking to Dr. Rab Stewart. We do it every single Monday. Every Monday is Darkside of the Pooch. It runs at noon and 8. Now go to Spotify. Our partnership continues. It's great. You can go listen to Darkside of the Pooches. We've got explanations of what she show's about. It's wonderful. You can listen to it whenever you want on demand at Spotify. Search Tony Kurre Radio. It's Kurre with a K, or Darkside of the Pooch. I can promise you it's the only podcast called Darkside of the Pooch. I know firsthand about snakes, and you know this because you're my veterinarian. I had one dog that's bitten 3 different times. We had a copperhead somewhere in our backyard, and I'm not a snake killer. I brought a snake guy in. He couldn't find it, and then the thing ended up in my front yard, and that's when I had to unleash holy hell on it, because I don't want a copperhead in my front yard, because that's where my kids play. But in the backyard, in a wooded area, I certainly understand it. A couple of hints. Certainly when a dog is sticking its nose into a hole or an old tree or an old tree trunk, and it's wagging its tail a little bit and it continues to jut in and out, it's more than likely not a squirrel or a chipmunk, because they'll run away. Snakes won't. They'll coil up and they'll go at it. Something I learned from you too is not all bites from venomous snakes certainly they're not always killers, but it really kind of depends on the season and whether that snake is actually eaten first, right? Because sometimes if a snake is fat and it's already eaten, it doesn't have as much venom in its system, correct?
Yeah, that's called a dry bite.
Yeah.
So yeah, if they've eaten recently, if it's a venomous snake, they won't have as much venom to inject, and so that's why this time of year is such a dangerous time, because the snakes come out from hibernation, and if your dog is the first thing that it's bitten in months, they're going to have a lot of venom.
Yep.
And so, we talked a little bit about the local things that happen, when we have a snake bite, but the more serious things that can happen is they end up having a hard time clotting their blood. Now that doesn't happen every time, because we have snakes that are not poisonous. And like we just said, we have snakes that may not, even if they're poisonous, they may not have a lot of venom, but they can cause clotting problems. And you can actually bleed to death without bleeding, if you don't have things to clot your blood.
Yeah.
And so the snake toxins cause the clotting cascade to be thrown off. So that's the problem with toxic venom.
We also have rattlesnakes and cottonmouths, I've been told here, and I haven't seen a rattlesnake, but I have seen a cottonmouth. I think the other thing that's really interesting, and you walked me through this before I actually had you as a veterinarian several years ago. I had a Freddy dog that got bit. He came up in the backyard, seemed normal. Then he started to vomit. Then I looked at his lip, and obviously you could see the puncture marks, and he obviously, and he just stood there. It was really bizarre, because they really don't know what they're feeling. They just stand there. They won't move. Sometimes they won't lie down, and obviously he couldn't eat. And I thought the interesting thing was I took it to another vet. Obviously I didn't know you at the time, and I was freaking out because I didn't want him to die. And then they asked me later on that evening if I would permit them to give my dog mouth to mouth to resuscitate my animal. And I said no. I at this point, I feel like he'll probably be okay. He did spend the night. It got pretty expensive. Can you talk about, first of all, do dogs ever need mouth to mouth? And what's the best thing to do if your dog gets bitten by a snake? Do you bring it in right away, or do you wait?
You can do mouth to mouth. I've never done that, because we just, if a dog's not breathing, we intubate it and we start giving it oxygen, and we put them on a machine and we breathe for them.
Yeah.
Because mouth to mouth in a dog is pretty difficult. You have to put their whole muzzle
Yeah.
in your mouth, and it's not very productive. It doesn't really work very well. So we just we get around that with our anesthesia machine and intubating them. Anytime something abnormal happens, it's best to have them seen, by a veterinarian. But treating snake bites is, if you read the medical literature, there's lots of stuff that is quote unquote controversial, and that just means that sometimes sounds crazy, but sometimes we're not really exactly sure how to treat it. So some people will immediately give a steroid injection for the swelling and inflammation, and put them on antibiotics. Some people will recommend giving anti-venom or anti-venin. You can pronounce it either way. And that, everyone knows what that is. You're giving a protein that will hopefully help with the reaction from the snake bite.
Mm-hmm.
But the problem with doing that is, if you're not 100% sure what snake bit your dog, if you give that protein, it can cause an even worse problem.
Oh.
because you're giving them something that they potentially may not need. So, that's why it's controversial, because we're just, sometimes you're not really sure. You're kind of left with seeing, okay, let's see what happens. Let's see how bad this is. And then you're kind of coming in after the fact and trying to play catch up. But most snake bites, I've only seen one really bad one, and it was a really bad local reaction where the dog, it was bitten and it got the skin died basically. And the dog lost a lot of the skin on its lower leg and foot, but we just did bandage changes, and over the course of several weeks, it healed. So dogs and cats are pretty amazing at their ability to heal. But snake bites can either be not a big deal at all or a huge deal.
More lethal to cats than dogs just because of their size?
No, not necessarily. I really haven't seen many snake bites in cats. I don't know if it's because most of our cats are indoors now, or when it happens to an outdoor cat, the owner may never know, because they may not see it for several days. And then at that point, the cat's either gotten over it, or maybe, it didn't do well and possibly died, and the owner doesn't know what happened to it.
Yeah. Dr. Rab Stewart, the Rossbridge Animal Hospital, Rossbridge Vet on Twitter, the Rossbridge Animal Hospital on Facebook, 205-208-0301. He's the best. Speaking of cats, Ben in Tuscaloosa's got 3 cats. He wanted to know, do cats ever get hurt? He said he sees his cats climbing trees. He sees them jumping from 20 feet. It's amazing the things they do, and he's never seen a hurt cat. I remember when I was 12 years old, I had a 10-speed bicycle, and I used to run this track around my house, and I actually ran over my cat. It lay low for about 3 days, and the next thing you know, it's up running around chasing mice again. We know they have 9 lives, but cats are pretty resilient, aren't they?
Yeah, they're really tough. And they, even when they are hurt, a lot of times they're not real good about telling you that they're hurt, so they do get hurt. We see them. But they seem to get hurt a lot less frequently than dogs. Cats are pretty smart, and they're pretty tough.
Is it just an agility thing? It's part of their genetic makeup that they're just very agile?
Yeah, I think so. And I think they're just really hardy.
Yeah.
A lot of times cats, they'll get the routine GI upset, and they'll get urinary tract problems from time to time, and they can get ear and skin problems. They can get all the stuff that dogs get, but they seem to either not get it as frequently. But the other thing to think about is the owners may just not notice.
Yeah.
So, the owners may not notice because the cat spends, several days up in somebody's room. Cats are just not quite, for the most part, they're not quite as affectionate or social as dogs. So that's not a hard and fast rule, but I think most people would agree that, cats kind of do their own thing sometimes. And so it may be that we just don't notice the problem. And, people say that a lot of statistics are made up, and this one may be too. But I had an old veterinarian tell me one time, I was right out of school, and I was, worried, and kind of, there's nobody there to help me anymore, when you get out of school. And he said, hey, buddy, listen, don't worry. 80% of what you see is going to get better on its own. And I don't necessarily believe that, because a lot of stuff that we see would not get better without intervention. But there's a little bit of truth to that, even for us. If you have a cold, eventually it's probably going to go away. Yeah. And I think maybe with cats, some of the stuff may just not get caught before the body has time to take care of it.
Do cats actually get caught up in trees?
Yeah.
Do they really?
Yeah. I think that's a question better for like
a firefighter,
whoever gets them down. But yeah, they get caught in trees. I think one time I had somebody call me so far in my career, there was a cat stuck in a tree, and they asked me if I could come get it. And I told them no, because I don't really have, I don't have the things to be able to get a cat down. And also I have to kind of think about my own, health. So I'm not going to go climbing trees for a cat, but it did happen one time.
And I think a cat would be smart enough that once it gets too high, it realizes. But I guess if it's chasing a bird or something, it gets up there, it looks like a child. I've been stuck up in a tree myself, and you get too high, and then all of a sudden you look down, you're like, holy crap, I can't get down. So that's kind of crazy. All right.
I think they're running. I think they're running from something when that happens. I don't think they're chasing something. Yeah, I think they were I think something chased them up the tree, because I think cats are smart enough to know not to go up there on their own. But if something's chasing them, they can get too high and not know what's going on. I think something chased it up.
And I'll piggyback this question because my cat likes to bring me gifts to my door, and we get a lot of moles. I've never seen a mole on my own, but our cat brings moles to our front door all the time. And unfortunately, he also brings birds. Do cats kill for sport, or do they kill for food, or do they kill for both? Because it looks like every time I see a cat, it'll just like want to numb something a little bit and just wants to play with it a little bit. And then, but then other times I'll get up there and all I'll be left to be feathers.
I think most domesticated cats probably kill for sport, because they know that they're well fed.
Yeah.
But feral cats, they have to hunt for food. So I think it's both, but I think most domesticated cats, they do it because that's just like their instinct, is to just go out and hunt. But I don't think they're going to eat it, because they know they're getting a meal inside.
Yeah. Unfortunately, unlike human beings who tend to gain 7 to 9 pounds over the winter months, and we have to deal with that coming in the summertime and the springtime, and now it's warming up a little bit. Our pets basically get fed the same time every day and the same food, so we don't have to worry about them getting fat, unless we've been sitting inside the last 2 years and we're giving them table scraps, and we don't want to have to deal with our dogs and this, that, and the other. We can't walk them. So Jonathan in St. Louis wants to know, what's the best way to help your dog lose weight? What's the best outside cutting back the food a little bit, getting some more exercise? Is there anything psychological you can do different for your animal to ensure that they can lose a couple pounds? And what is a healthy weight loss for a dog? Is it a pound a week, a pound a day? What is it?
So diet and exercise in combination is what you want to do. And that can be cutting back their normal food, a little bit. Or it can be switching to a food that is for weight loss. Almost, every pet food company has a certain diet that's for weight loss. So just trying to get them out and exercise them, while also adjusting the diet. You want to do both. And then if that doesn't really work very well, dogs can have medical problems, and cats where, they're not able to lose weight. Cushing's disease is one. The body's making too much steroid, and so that leads to weight gain. Or having an inactive thyroid, that can lead to weight gain. Dogs can also be diabetic, but usually, believe it or not, diabetic dogs have trouble maintaining their weight because they're losing weight. Cats are the opposite. Cats usually get fat with diabetes, but dogs are a little bit different. There's not a really in dogs and cats, we go by something called the body condition score, and not so much by their actual number, because you have a tiny little teacup Chihuahua, and then you have a giant Mastiff, and so you can't say, all right, well, both of these dogs are overweight, they both need to be, they both need to lose 5 pounds, because the teacup Chihuahua only weighs 2.5 pounds anyway. So we go by the body condition. So the body condition score, it depends on, there's kind of 2 different ones, but I typically use one that goes up to 9. And optimum body condition means that you can feel the ribs individually, but you don't see them.
Okay.
And then they are slightly more narrow in the waist than in the chest. So that's an optimum body condition.
It's like
if you
humans.
cannot feel the, if you cannot feel
yeah.
the ribs individually, then they're too big. If they're basically a straight line all the way back from their shoulders to their hips, like they don't have any indentation there past the rib cage. If they just go straight back, they're too big. If you can see the ribs, then they're too thin.
Okay, and when you say too thin, and obviously I got to have an ease, and you can't see his rib cage, but when you pick him up, he feels super light, and you can feel some of his bones. But I feed him twice a day. He just sometimes doesn't want to eat. Is that okay?
Yeah, as long as he's not having any other problems like GI, like vomiting, diarrhea, and he's not lethargic, then some dogs are thinner than others, But if you have a dog that has long hair, and the best way to figure out if they're too thin is just get them wet And then if you can see the ribs once their hair is down and wet, then they're probably a little underweight.
And I think it's, as a dog owner, and I love my animals, you got to be a responsible dog owner. And I think we want to please our pets. We know they love scraps. We know it tastes really, really good. And of course, once you start feeding them from the table, they're going to be sitting there begging. And then you yell at them, don't beg. And it's like, well, you just gave them something last night. But I mean, there's nothing worse than seeing a dog that's 10, 11, 12 years old and can't carry its own weight because it's so overweight.
Yeah. And I mean, it puts a lot, just like us, it puts a lot of strain on their joints. And it can limit their life for sure.
All right. So springtime, if you want to get your dog on some weight loss, what is a good weight loss program as far as, and how many pounds a week should your dog be losing? Let's say a 50-pound dog, it should be weighing 35.
Well, I mean, you definitely want to take it slow.
Yeah.
And so I don't know that I could give people an actual number,
okay.
To go on. But if you're just looking for like a rule of thumb, hey, my dog needs to lose weight, then the best rule of thumb is, okay, cut its food back by a quarter for the day.
Mm-hmm.
So just, I'm not super great at math, but if you're giving them a cup of food twice a day, all right, then you need to give them 3/4 of a cup twice a day. Cut their food back by a quarter, and then reweigh them in a month.
Okay.
If it's a 50-pound dog and you've lost a couple pounds, then great. Then keep doing that until you get to where they have that optimum body condition. Because again, we're not really looking for a number. So I can't say you need to lose this amount of pounds and then you'll be at your optimum body condition. It all goes by how they look to us. It's that, feeling the ribs but not seeing them and having a tapered waist. So it's really just the eye test.
And I will say this too, if you're doing all the right things and your animal's still getting fat, look over the neighborhood and see whose trash they're getting into, because if there's something dead in the backyard or they can go across fence lines, they're probably getting into someone's trash. Because I had one dog that I did everything right and that dog just kept coming back. But that was the only dog that didn't come back after I called it in because it was rooting through someone's trash, right?
That's right. Yeah, man, they love it. Garfield the cat.
All right. Anything else exciting going on at Rossbridge Animal Hospital? You want to share any extensive stories that you've done, any weird surgeries or anything?
Man, we've had pretty much all just routine stuff lately. But you know what? I was going to go back to your first question. An album that surprises me that is not on there for a longer period of time would be the Eagles' greatest hits.
That's probably number 4. You may be onto something. And in our lifetime, it probably will get on there.
Yeah.
Because as soon as I don't want to wish this upon anybody, but as soon as someone from the Eagles passes away, much like Glenn Fry, we go out and buy all their stuff again, and it goes right back on the list, and it'll be on there for another year. So that's a great point. I'll have to look that up and see what number 4 is. It's a great trivia question.
It's got to be up there.
You're the man, man. Doc, thank you so much again. Rossbridge Vet, at Rossbridge Vet on Twitter, the Rossbridge Animal Hospital right there on Facebook. You can give them a call anytime. They're the best. 205-208-0301. Dr. Rab Stewart, we appreciate you. Thank you.
Thanks, buddy. Talk to you next week.
This has been a special presentation of Tony Kurre Radio.